Hello to the all of audience. We are from SGD number B1 would like to present our student project entitled Immunomodulator. But before we continue to our presentation, we would like to introduce our members, which shown in the slides. For the next speakers, the time is yours.
Hello everyone, my name is Komang Sri Bungasidani with the last three digit of student number is 241. I will explain the chapter 1 of the student project. The first one is background. The body actually can divide itself independently through its immune system. The immune system is responsible for recognizing and fighting pathogens or foreign substances to prevent inflammation and maintain the body homeostasis. Immune cells can be found throughout the body, especially in the blood, but they have specific receptor targets for each organ. This allows the immune system to rapidly generate a large number of cells to stop the spread of an infection. Sometimes it is necessary to modify the immune system to produce the specific antibodies required by the body. Substances that possesses this ability are referred to as immunomodulators. Immunomodulators can be categorized into two major groups: immunostimulator, which stimulate the increase and activity of the immune system, and immunosuppressor, which inhibit or suppress the activation of the immune system. Immunosuppressive drugs are commonly used to treat patients with autoimmune disorder, organ transplant, and other. For example, is corticosteroid known as AIDS, histamine agonist, and other cellular signal inhibitor. Immunostimulants are used in patients with AIDS, chronic infection, malignancies, and other conditions. For example, is BCG, Bacillus calmette-guerin or vaccine, isoprenosin, levamisole, vitamin C, and others. For the side effect, starting from mild symptoms such as dry mouth, headache, nausea, and vomiting, to more serious conditions such as bleeding, decreased kidney function, liver damage, and others. It is necessary to have a proper monitoring from the doctor to get the therapy objective or achieved optimally. Based on the background, the problem formulations are: what is an immunomodulator, what substances can be categorized as immunomodulators, how is the mechanism of action of each immunomodulatory substance, what are the indication and contraindication for the use of each immunomodulatory substance in the treatment of disease caused by the immune system. Are there any side effects of using each immunomodulatory substance in the treatment of disease caused by the immune system? For the objective, the first one is general objective, is to know more about what immunomodulators are and their role in helping the immune system to prevent the disease in our body. For the specific objective are to understand what immunomodulator is, to know the categorization of immunomodulator, to gain knowledge on the mechanism of action of each immunomodulatory substance, to learn about the indication and contraindication of each immunomodulatory substance in order to be able to choose the appropriate treatment for the patient, to know the side effect of each immunomodulatory substance, so in the treatment it can be minimized. For the benefits is to gaining knowledge about immunomodulators. The writers can provide a deeper understanding of their categorization, mechanism of action, indication, contraindication, and the side effect for effectively managing disease caused by the immune system, with hopes to expand the scientific knowledge.
Thank you. My name is Gede Pramaditya Wahisa Putra, and the last three digits of my student numbers are 045. In this occasion, I would like to present the definitions of immunomodulator. Immunomodulator are medicines that are often used to modify the immune response when it doesn't work properly. Immunomodulators work by increasing the immune response, which is called immunostimulant, when the immune system does not respond to pathogen sufficiently, or decreasing the immune system, which is called immunosuppressant, when the immune system overreacts to pathogen, and also often used in autoimmune cases. Immunomodulators can act on specific action or non-specific action. Specific action immunomodulators affect the immune response of the cells by the presence of particular antigens, such as adjuvants or vaccines. On the other hand, non-specific action immunomodulator work by suppressing or stimulating the immune response without directing the activity of stimulated cells to a specific antigen. That's all for me. Thank you.
Hello everyone, my name is Rafa Diardra Fajri with my last three digit of my student number is 244. Okay, so definition. Immunosuppressants is a group of drugs that hinder or reduce the strength of the body's immune reaction. The majority of these drugs are employed to make it less probable for the body to reject a transplanted organ. The commonly used immunosuppressant drugs include cyclosporin, tacrolimus, prednisone, azathioprine, sirolimus, and many more.
Okay, thank you for the time. My name is Yuda, and I would like to explain about the mechanism of action of immunosuppressant. We have six common immunosuppressant. The first one is corticosteroids, with the mechanism of action is interaction with the intracellular cytoplasmic glucocorticoid receptor, or GR. The second one is antimetabolite agent, with the mechanism of action is disrupting the process of DNA synthesis and impeding the growth of cell. The third one is calcineurin inhibitor, with the mechanism of action is remain in a quiescent state due to the absence of T cell activation signal. The fourth one is mTOR inhibitor, with the mechanism of action is exhibit binding affinity towards FKB12, a cytoplasmic immunophilin. The fifth one is polyclonal anti-lymphocyte sera, with the mechanism of action is exhibit a diminishing impact on lymphocyte. And the last one is intravenous immunoglobulins, with the mechanism of action is exhibit an immunomodulatory impact, but the precise mechanism on which remains incompletely understood. Okay, that's all from me. For the next speakers, the time is yours.
Hello everyone, my name is Asikirana with Trilla student number 087, and now I would like to explain about indication and contraindication of immunosuppressant drugs. Immunosuppressant drugs are indicated to inhibit or reduce the intensity of excessive immune response within the body. These medications are typically recommended for the treatment of autoimmune disease. The majority of these drugs are used to make it less probable for the body to mount resistance against the transplanted organ, thereby preventing the immune system from attacking the newly transplanted organ. Various immunosuppressant medication can prevent the rejection of transplanted organs such as cyclosporin and sirolimus. Cyclosporin finds clinically application in solid organ transplantation to prevent the rejection of organs such as kidneys, livers, and heart allogeneic transplants. It is also indicated in patients with rheumatoid arthritis and has received approval for the treatment of amyotrophic lateral sclerosis and its variations. The same as cyclosporin, sirolimus in combination with corticosteroids also can prevent transplant rejection in individuals who have received renal allograft. It is also employed in the management of pulmonary lymphangioliomyomatosis and serves as a secondary medication for treating skin cancer in kidney transplant recipients. Although immunosuppressive agents can be highly effective, they also have potential risks and contraindications that need to be considered. Contraindication for immunosuppressant may include hypersensitivity to specific immunosuppressive drugs. Some immunosuppressant medications have the potential to reduce the effectiveness of live vaccines and increase the risk of vaccine-related complications. The utilization of specific immunosuppressant during pregnancy may pose a risk to fetal development. Furthermore, these drugs are not recommended for patients who are already significantly immunosuppressed due to pre-existing medical conditions. That's all from me. Thank you.
My name is Aaron Arnas with ROSG number of student ID is 002. I will explain about the side effect of immunosuppressant. Certain autoimmune disease can be effectively treated with immunosuppressants, which can also lessen the likelihood that your body will reject stem cells or transplanted organs. But like the other medicines in general, if they are used irrationally, there are potential risks or complications. It is necessary that you take immunosuppressant according to your doctor instruction. Immunosuppressants are potent medications that have various negative effects, such as high growth, weight gain, high blood pressure, diabetes, fatigue and headache, acne, stomach upset, nausea and vomiting, blood, fungal, skin respiratory infection. That's all from me. Thank you.
Back to me again, Rafa, with my last three digit of my serial number is 244. Definition of immunoadjuvants. Immunoadjuvants are substances that activate antigen-presenting cells, inducing innate or adaptive immune responses. They have similarities to molecular patterns associated with pathogens and primarily engage with toll-like receptors located on antigen-presenting cells, including B cells, macrophages, and notably dendritic cells. Example of an immunoadjuvant is BCG, alum, and CpG.
Hello, I'm Aryu with student number 123, and I'll be talking about the mechanism of action of immunoadjuvant, which is located in vaccines. Basically, there are two main signals that is being played, the antigen-presenting signal and the co-stimulatory signal. Each of them can be stimulated by immunostimulant and delivery system. Immunostimulant will be covered later, but delivery system is basically a mirror to carry antigen that can improve antigen presentation and uptake by APCs. It also stimulates co-stimulatory signals to help make more cytokines and improve adaptive immune response. There are four ways a delivery system can act inside the body. First, it prolongs the antigen bioavailability to help APCs access an adequate amount of antigens. Second, APCs targeting to facilitate an efficient uptake by imitating the size of viruses and to direct specific receptors on APCs. Third is lymph node trafficking, that is to send antigen straight to lymph nodes. And the last one is antigen cross-presentation, that is to present the antigen itself to the CD8 plus lymphocyte.
Good morning, Dr. and everyone. My name is Nadia with my last unit number 160, and I'll explain about the indication and the contraindication of immunoadjuvants. So, in some cases, immunoadjuvants have been used as a substance to boost vaccines. They are believed to hold the ability to stimulate the innate immune system and set off a particular adaptive immunological reactions. Other reason why they are good for medication is because their minimum vaccination with a regular stimulation, the cyberprotective immunological response, hence a lower incidence of major side effects. Vaccines have been known to use immunoadjuvant where cancer vaccines and infectious disease vaccines. And for the contraindication of immunoadjuvant is that one of immunoadjuvant substance such as alum in the human papillomavirus were believed to involve in a chronic fatigue-like syndrome, and some immunoadjuvants have a systemic toxicity such as inflammation, and they could induce the presence of melanoma. That is all for me. The next presentation will be presented by my friend. Thank you.
I'm Gusti Agung Krisaniama Putri with the last 3 digits of my student number R143 will continue with immunoadjuvant side effect. Adjuvanted vaccine may cause negative effects such as autoimmune or inflammatory syndrome induced by adjuvant or ASIA. Clinical manifestations that may commonly be seen in the patient with ASIA are pyrexia, memory loss, sleep disturbances, arthritis, arthralgia, chronic fatigue, demyelination, rheumatoid, myalgia, and myositis. The development of autoimmune disease such as systemic sclerosis can also be seen in those patients. Side effects also occur in specific adjuvants. For example, aluminum neurotoxicity may disrupt endocrine and essential cellular process and may also trigger on immune inflammatory process in the brain that leads to long-term neural dysfunction and severe central nervous system disorder. Aluminum also activates the NLRP inflammasome pathway that triggers type 2 diabetes. Besides from that, AS03 adjuvant also has a possible association with narcolepsy when used in the H1N1 influenza vaccine. That's all from me, thank you.
Okay, back to me again, Rafa. Definition of immunostimulants. Immunostimulants are a heterogeneous group of compounds that act non-specifically on the immune system by stimulating its activation, either by increasing its activity or by promoting the function of a specific component. Are thalidomide, isosprinocin, immunosinin, bestatin are some of the examples of immunostimulants. Maybe that's all from me, continued by my partner.
Hello, my name is Nyoman Gede Wilogunarti Paramarta and my last three-digit number is 180, and I'm going to explain about the mechanism of actions of immunostimulants. The first one is enhanced antibody production. Antibodies, also known as immunoglobulins, are protein produced by B cells, play a central role in its ability to be recognized and neutralized by the immune system. Immunostimulants work by activating and amplifying B cell responses, thereby increasing the production of specific antibodies designed to target and neutralize invading pathogens. This improvement in antibody production is especially useful in situations where the body must develop a rapid and effective immune response, such as during infection or vaccination. The second one is activation of immune cells. Immune stimulants exert their immunomodulatory effect through the activation of various immune cells, especially macrophages, dendritic cells, and natural killer cells. These specialized immune cells are essential components of the innate immune system and play a central role in identifying and eliminating invading pathogens. Immunostimulants achieve this activation by binding to specific receptors on the surface of immune cells, or by initiating intracellular signaling pathways. This activation leads to increased phagocytic activity, increased cytokine production, and a stronger immune response. The next one is cytokine production. Cytokines are key mediators of the immune response, acting as messengers that coordinate the activities of different immune cells. Immunostimulants can stimulate immune cells to release specific cytokines, such as interferon, interleukin, and tumor necrosis factor or TNF. The stimulation has a significant effect as it can lead to improvement in innate and adaptive immune responses. For example, interferon production can help fight viral infection, while interleukins can regulate the activity of immune cells and facilitate communication between them. And the last one is toll-like receptor activation, or TLR. TLR play an important role in the innate immune system by recognizing specific pathogen-associated patterns, such as bacterial or viral molecules. Immunostimulants mimic or enhance the binding of PAMPs to TLRs, causing a cascade of intracellular signaling events. This activation of TLRs then triggers a robust immune response, including the production of inflammatory cytokines and recruitment of immune cells to the site of infection. By using TLRs, immunostimulants effectively prepare the immune system to identify and fight a variety of pathogens, making them valuable tools in the prevention and treatment of infection, as well as an adjuvant in vaccine. So that's all for me. Thank you.
Hello, my name is Jinderka Pramesti with the last 3 digits number 208. So now I'm going to tell about the indication and contraindication of immunostimulant. So immunostimulant have been used to prevent respiratory tract infections, work by enhancing non-specific immunity against several respiratory insults. Immunostimulant also used in cancer treatment to enhance the body immune response against cancer cell. Non-specific immunostimulant are used in immunodeficiency diseases to stimulate components of the immune system without antigenic specificity, work by enhancing the immune response against wide range of antigens. Patients with hepatic or renal failure can be a contraindication to some immunostimulant, which both organ could alter pharmacokinetics of the drug. Pregnancy and lactation also contraindicated of immunostimulant because of potential adverse effect to neonate or fetus, such as fetal abnormalities, increased maternal and fetal infections, and suppressed immune responses in nursing babies. That's all from me. Thank you.
Okay, so hello everyone, my name is Fariza Husni Adiba with three last digit of student number 102. So I'm gonna explain about the side effect of immunostimulant. So because the side effect may be vary according to each kind of stimulant you use, I'm gonna give some names and then tells you what side effect they have. So the first one is non-specific immunostimulant. We have interleukin 2 that exhibit flu-like symptoms, and some of them may experiencing vomiting and diarrhea. And the next one is interferon. They have fever, headache, vomiting, diarrhea, and this one is important. They also exhibit sleep disorder and depression, so they can have like psychotic effects. The last one is levamisole. They have notable side effects such as nervous system disorder and multifocal inflammatory leukoencephalopathy. That's why they have been withdrawn from the market. And we move to the next one, that is specific immunostimulant. Just like the name, they enhance the specific immune response. So they have bacteria vaccinations and viral vaccinations. For the bacteria, I use pneumococcal vaccine and BCG vaccine. The pneumococcal one, they have fever, swelling at the site of injection, and loss of appetite. And the BCG one also has similar side effects with complications including lymphadenitis. And for the viral vaccinations, I use COVID-19 vaccine. So they have fever, soreness, headache, and diarrhea. I guess that's all from me. Thank you.
Thank you. And now I would like to continue the presentations about the conclusions of this paper. Immunomodulators are medicines that are often used to modify the immune response when it doesn't work properly. Immunomodulators can be categorized into three major groups based on their mechanism of action. They are immunostimulants, immunosuppressants, and immunoadjuvants. The first one is immunostimulants. Immunostimulants is a group of compounds that act non-specifically on the immune system by stimulating its activation, either by increasing its activity or by promoting the functions of a specific component. The second one is immunosuppressants. Immunosuppressants is a group of drugs that hinder or reduce the strength of the body immune response. The third one or the last one is immunoadjuvants. Immunoadjuvants are substances that activate antigen presenting cells or APCs, inducing innate or adaptive immune response. That's all for me. Thank you.
Okay, that's all from us. We apologize if there are any mistakes in our presentation, and thank you for watching our presentation.